sinuses is definitely one where I say pay attention to your doctor's orders. Some doctors only want one specific view. Some want like a waters and a lateral, and some want the full series. So always, always, always read your referrals. But routine views for adult and what we consider a competency includes a lateral, a PA Caldwell, a waters, and an SMV. There is a special view. It's called an open mouth waters, which we do rarely. And then pediatrics for us routinely for under 18 will be a waters and lateral only, unless the pediatrician specifies they just want a waters, and that happens a lot. Most kids are a waters only. So some technical considerations: I always clean my bucky in front of my patient. That way they see it before they put their face on there. Wash your hands, wear gloves, don't touch their face without gloves. And I always ask if there's a side of pain. If their right sinuses are really hurting, I choose to do a right lateral. I want to put the part of interest closest to the IR. KVP for us tends to be between 75 and 80, depending on equipment. The patient either needs to be standing or they can sit down on a stool, which, me being on the shorter end, I find that to be much easier for me. I sit them down on a stool and I can look right over top of them to see if they're rotated or not. Horizontal beam, always, always, always. Never angle your tube for sinuses because we're looking for air fluid levels. AEC is not recommended. It tends to over penetrate the sinuses because it's trying to penetrate through the facial bones as well. So try and set your own. Waters. So waters view, I remember because I feel like it looks like the patient is coming up out of the water for a breath. They're looking up. I have them set their chin on the image receptor, and then I look for the MML, so mental meatal line, right? So from their ear to their chin, and that you want that to be horizontal. You want your beam to exit at the acanthion. So if your bucky has a line across here, put that right at the acanthion. You're not going to angle your tube, but the angle of the OML right here is going to be 37 degrees. Okay, you're not going to measure that. That's probably just going to be a random board question. The petrous pyramids project below the maxillary sinuses. Remember, head stuff, petrous bridges are where you want to look, okay? So on the waters view, that's mainly for the maxillary sinus, right? So that's what we want to focus on. So maxillary sinus is here. And your petrous ridges you want below the maxillary sinus. So if they're in the maxillary sinus, you have not raised them up high enough. Their MML was not horizontal, okay? This is a demonstration of what an air fluid level would look like. So see how this one is nice and black all the way around? This one here is black only on the top, but this white area here, this kind of foggy area, that is the fluid sitting in the sinus. This is an open maxillary sinus here. This is a full. This is an open maxillary sinus here. This is a full maxillary sinus on that side. So I want you to evaluate this image quickly for me for positioning. So this is supposed to be a waters view of the sinus, right? So we want to look for the maxillary sinuses nice and clear. But what you can see here are the petrous pyramid coming through kind of the lower third of the maxillary sinus. So what does that mean? That means their chin isn't up high enough, that MML is not horizontal. So that patient had to look up higher. This was an example here of positioning errors. So obviously you can see the line coming through the maxillary sinus. They weren't up high enough. Okay. PA Caldwell of the sinuses. So what you're going to do is you're going to put the patient, I start with their forehead and nose kind of against the board here, and then you want the OML right here to create a 15-degree angle from horizontal. So you're actually lifting them up slightly. Most often their forehead is probably not going to touch on this system. The central ray is exiting at the nasion. This other image here is demonstrating a bucky tilt method. So instead of raising the patient up 15, they have tilted the board 15. We do not use that at our clinical site, but that's another option. This support sponge just helps the patient stay in place. So feel free to use that if you feel like your patient can't hold the position. The PA Caldwell, we're mainly focusing on frontal and the ethmoid sinuses, and the petrous ridges are going to be in the lower third of the orbit. Really similar to that of the Caldwell of the skull, right? Demonstration here, just of sinuses, clearly identified. Another pretty picture here of sinuses. SMV. This one is difficult for a lot of patients. I definitely usually demonstrate this for them. I use a chair with a back on it, and I scoot it a little bit forward. I have them sit on that and lean back till the top of their skull touches the image receptor. You want the IOML parallel to the image receptor here, horizontal beam, of course, right? Central ray is going to be 2 inches below the mentum between the two angles. We're looking for ethmoid and sphenoid sinuses here. This one, try and be quick with because it's hard for your patient to hold. All right. And this is what it will look like. So you're looking in here for your sinuses underneath. Another pretty picture here. And more anatomy here. So ethmoid, sphenoid, that's your area of interest. Thoughts on positioning. So looking at this SMV attempt, right? So we can clearly see the orbits, we can see the nasal bone, we can see the teeth here. So this patient, they are not with their head up against the image receptor. So their chin is tucked down. They need to go further back, okay? If I go back to, I tend to stand right next to my patient here and look at their forehead and chin as well, and look at that alignment. So their forehead may need to tilt back a little bit more. Okay, and then lateral sinuses. So again, if they have a pain on one side more than the other, I try and put that side of interest closest to the image receptor. I stand my patient similar to the way she's standing. She's kind of in an oblique. I drop that shoulder back and try and bring their face as close to the image receptor as I can without rotating the patient. So you want those interpupillary lines straight on. I look right in front of my patient and try and get them in a true lateral. The central ray is going to be between the outer canthus of the eye and her EAM, so right in here. Use a support sponge if you need to, if you think they can't hold in place. This is the ideal image to see all 4 sinuses. Sphenoid sinus is the major focus of the lateral, but all 4 sinuses are demonstrated. All right, and you're going to look for lateral positioning similar to that of your lateral skull. So you have your sella turcica superimposed, your mandibular rami superimposed here. Okay, you do not need the entire skull on, so please make sure in column 8 we only need the front part here. Okay, for the sinuses. Just another nice anatomy picture of the lateral sinuses. You can do a cross-table lateral sinus if you would had to do that portably. That's the only one that's the only sinus view you can do with the patient supine as a cross-table lateral. A specialty view is an open mouth waters. So position the patient really similar to that of the waters view, chin on the image receptor, looking up, except for they're going to open their mouth wide. This is going to look at the sphenoid sinuses. And usually we do this one if they can't do the SMV. All right, we'll replace it with this open mouth waters to try and